There you are. Thank you for staying with Your World on NTV this morning. It's time to resume our conversation, but we're shifting gears and now to focus about matters education, matters learning, and specifically higher learning. And of course, the nexus between that and our progress and acceleration towards the achievement of sustainable development goals. And who better to talk to us about than the people who actually deal with higher learning every day. I'm joined in studio this morning by Dr. Eunice Durango. She's the Dean of School of Nursing and Midwifery, East Africa at the Aga Khan University. Good morning and welcome to the show.
Good morning. Thank you very much.
Asante. And also joining us in studio this morning, Dr. Alex Awiti is the Vice Provost for East Africa at the Aga Khan University. Alex, good morning. Welcome to the show.
Good morning.
All right, and joining us virtually this morning is Dr. Lukoye Atuoli, is the Dean of Medical College, East Africa at the Aga Khan University. Good morning, Daktari, and welcome to the show.
Thank you very much. Good morning, everyone.
Right. Let me just start with you, Eunice, and maybe because before I start with you, we also want you as our viewers, of course, to be part of this conversation. We will be talking a lot about something called the Sustainable Development Goals. Which one matters to you most among the 17 of them? You can be part of this conversation by tweeting us at NTV Kenya and at Victor Kiprop _ using the hashtag #NewNormal. You could also follow the conversation on YouTube, Facebook, Instagram, and Twitter, where we are streaming live. And if you're not on social media, surely you have a mobile phone and you can call in on the numbers below your screen. So there's no excuse. Eunice, let me just start with you. This sustainable development goals, the 17 of them were put up in place to sort of launch the planet on a sustainable path. Maybe let's start with the role of education in ensuring that we stay on that path or in this journey.
Thank you so much. To start with, Sustainable Development Goal number 4 is the one that directly deals with education. So it talks about inclusivity, but also talks about equity in access to quality education. But we all know that education does not start and stop with only that Sustainable Development Goal, because if you have equitable access to education for the girl child, for instance, then you're going to sort out yet another SDG that is around gender equality and equity. If you have a good education, you have higher education, it also means that you have opportunities for access to the job market. So that means then the economic infrastructure, innovation as other SDGs are also addressed. It also means better income, so poverty, the poverty SDG is also addressed. So indeed, education is central and key to that. It automatically or eventually does affect the other SDGs. So they're all interconnected in a manner of speaking. And
if you look at it, then it becomes a sort of a prerequisite for the achievement of all the other, many of the other, of course, SDGs.
Exactly, precisely.
All right. And Alex, maybe, do you think then that most of the time we try to look at education from the lens of the 4th SDG? Do you think that has become some sort of a very narrow lens to look at it?
Yeah, I think the framers of the SDGs were very comprehensive in the framing of those goals.
Yeah.
And if you look at all the 17 goals, they fall into almost 3 buckets, so to speak. There's one about just human well-being, and there is a bucket that contains the economy, and there's a bucket that contains the environment. So I think it is the interactive effect of these 3 goals, the associative interactive effect of these 3 goals, of these 3 buckets that delivers the full-scale impact of the Sustainable Development Goals. But what is critical is that they're synergistic. You know, you cannot achieve any of those goals if you undermine any one of them, in a sense. So as Eunice has said, you need to eliminate hunger. You need to create a path to gender equality. If you to achieve any elements of a sustainable economic framework, especially access to decent jobs, innovation, for instance, you need a literate population. There's a very strong correlation between mean years of schooling and GDP. So countries that have very low numbers of school years for the general population inherently have very low GDP. So that's critical. But how do you get kids to stay through school? You get kids to stay through school when their parents have decent work, when you eliminate household poverty, when they have access to good nutrition. You eliminate gender inequality if girls have access to education, not just primary education where we've achieved parity, gender parity, but also access to higher education, post-secondary education. So again, all of these the other goals relating to a sustainable environment, environmental stewardship, an illiterate population will not start to advance those goals of, say, climate change, climate action.
I like the statistics that you're bringing in, because I was looking at this report from the OECD and it was confirming that people with higher education degree are less likely to be unemployed and earn an average of 54% more than those who completed upper secondary education.
Yeah. So again, the UN has also come with another metric called the Human Capital Index. So the countries that are very high on the Human Capital Index also have the best attainments in Human Development Index. So there's a very strong correlation, associative correlation between several of these factors. And that's why I think, the genius of our time is actually the design of the SDGs. The question now is the implementation and funding and financing arrangements to attain these goals.
Okay. Let me just bring in Dr. Atwoli here. I mean, clearly, given the fact that education appears to be a prerequisite for the achievement of these issues, back in the day, education just seems like, going to school, getting some skills and knowledge enough for you to get a job. But you can't help but feel that in the era of SDGs, the role of higher education is changing and is becoming even much wider.
Yes, of course, Victor. I think higher education institutions go beyond just the goal of education alone. So higher education institutions are called higher education institutions because they not only do the education component of teaching, but they also generate the knowledge that is necessary for you to do teaching in a meaningful way. And they also have a component where they provide service across all these SDGs. We look at SDGs as an attempt to enable humans to live a meaningful life. And to live a meaningful life, therefore, you have to look at all these 17 components of these 17 goals, which are attempts to break down what does a meaningful life for a human being entail. And so institutions of higher learning will generate the knowledge that will break down these 17 goals into meaningful steps that people can take to start moving towards those goals. And as institutions of higher learning, then they will address that SDG number 4, but also the other SDGs, as my colleagues have pointed out, that an educated individual stands a better chance of living a meaningful life. And education should not only be seen as preparation for jobs. Education should be seen as a core part of human development in and of itself, rather than being prepared for the job market. It also prepares you, for climate action. It prepares you for a sustainable environment. It prepares you for better relationships with other human beings. And it should not only be seen as a pathway towards jobs, but as a pathway to a more meaningful life.
And maybe we should add a rider there then, that it's not just education, but quality education.
Absolutely. So, education plays a role. So society set up educational institutions in order to prepare young people to interact better with the social environment that they find themselves in. And the quality education ensures that the persons going through the educational pipeline, when they emerge out on the other end, are better citizens, they're better stewards of our environment, they are socially active and aware, and therefore we prepare them to cut across all these goals. So, and as we said, a more educated person is less likely to be poor because they have more opportunities at economic empowerment than a less educated person, and so on and so forth.
Okay. Now that we've clearly defined the significant role that higher education plays, I mean, Eunice, do you think then that Kenyan universities and institutions of higher learning are playing that role at the level that they should?
My view always is that there's always room for improvement. And I think some of the things that need to perhaps come to the fore, and there are things we are really doing quite intensely at Aga Khan, is around thinking, how do we structure the education? And Lukoy has alluded to this.
Yeah.
What is it that needs to be in a good education program? We perhaps historically come from the ethos that a good curriculum or a good program is the one that is really content heavy, because we need to teach these graduates as much content as possible. But now we are realizing that with the changes in the world, the changes in the global landscape, COVID has shown us this quite well, is you are looking for a graduate who, on completion, on graduation, is able to survive somehow, whether it's in the workplace, whether it's in their personal life, and so on. So the focus really for us as higher education providing institution is to think about how to structure education that helps our learners to be a lot more innovative, to learn how to learn, because the end result here is lifelong learning. So I think that's what we should perhaps do a little bit more. The other angle to this, and Luca has alluded to the idea of research and the role it plays. So we do have research that then focuses on the clinical, the practice, or the industry element. But we also need to look at research that focuses on how people learn. How do we teach people in this particular setting so that they are better graduates in the end, so that they are not crammed up with information, but rather they are graduates who can innovate, who can think critically, who can problem solve, who can reflect about what they are doing in their day-to-day job or in their day-to-day lives and seek to improve that. So to me, that's what higher education should be doing. And that's really the emphasis of what we continue to do at AKU.
Okay, and part of that significant role is through research. Alex, talk to us about the issue of research, especially in Kenyan learning institutions, and are we actually playing at the level we should be playing?
That's a good question. We've had a constant and unresolved conversation around public financing for research in the country, NACOSTI, and the requirement that we need to spend at least 1% of our GDP on research, and even more. We've not attained these goals. So I think if you look at it per capita, what we call per capita production of global public goods that come out of research from this part of the world, it's very, very low. If you look at the total population in aggregate of publications that go into international journals, create international global knowledge, Africa's contribution is still very low. And Kenya is in that ballpark. So our research output is still very low. If you look at the scale of innovation that arises from local patents, from local research activity, that's still very low. We have a lot of unresolved problems here that are crying out for innovation, which is a critical goal, which is a critical role of higher education. It is innovation. It is creating solutions, local appropriate solutions for local problems that originate from the thinking that is created as a response to these problems by the people who understand them better. Still now, look at construction. We are building these super duper highways, but who is the main contractor? Look at everything else that we consume in this country. We are basically a warehouse economy, the manufacturing, which is also a critical part of the SDGs, industry, manufacturing, and innovation. All of this stuff still comes from outside. So I think there's still a huge role for universities. As Uni says, there's room for improvement. We need to put in more resources to fund higher education, to build research capability, but also tertiary levels of education, like our polytechnics, mid-level colleges. These are waiting, they're potential hubs of innovation in the country. So to the extent that research remains underfunded, to the extent that we don't have a strong research voice. The President Kenyatta does not have a scientific advisor in his cabinet.
That's a very important point.
That really downplays the role of research in the country. And now you've seen the questions around drug manufacturing, drug discovery, drug discovery, vaccine development, and all of that. We're lagging behind. We're waiting for China and India and everybody else to supply us with vaccines. But if you talk to Lukoy, these capabilities existed. The problem is that they've been underinvested in. KEMRI, ILRI, institutions that exist here that could be at the forefront of producing vaccines.
Dr. Atwoli, I don't for one second doubt the intellectual capacity, but why is the output so low? Is it just the issue of underfunding, or are there other issues?
I think you've hit the nail on the head. You cannot do meaningful, high-quality research without funding. You have to explicitly set aside money for funding research. And the reason is that a lot of the research that is required needs investment in infrastructure that allows the scientists and researchers to do certain tests and experiments that will then produce the products that we are talking about. Kenya has, some of the most educated people in the world. And in fact, if you travel across the world and visit institutions of higher learning anywhere in the world, you're likely to find a Kenyan doing high-level work in a research institution or a university outside the country. So we do not lack the intellectual capital. But when we are here, often we struggle to access research funding. Our government sets aside very little money to fund meaningful research in this country. You will find that many of us who are doing high-level research are funded by outside external organizations like the National Institutes of Health in the US, or the Medical Research Council in the United Kingdom, or other external funding agencies rather than our own government.
Okay.
And obviously that means that for many researchers, their goals have to converge with the goals of these external funding agencies.
Okay.
Incidentally, every once in a while, those goals converge with Kenyan goals, but that's not always the case. So we have to put the money where our mouth is.
And you've raised another very valid point right there in your analysis, that issue of brain drain. So because as I mentioned, we don't lack the intellectual capacity. And for a very long time, many people have been wondering, why do you go to another important university, you see an invention outside the country, and a Kenyan name is always somewhere there. Why are we seeing this trend of people deciding to, let me just go and pursue my project elsewhere?
The truth of the matter is that many of us went into higher education and into our vocations for personal fulfillment. We went in there to make a difference. And we didn't go in there to just sit and wait for retirement. And if you get an opportunity outside the country that allows you to make a meaningful contribution to society, and that allows you to pursue your dreams, I do not begrudge anyone taking up that opportunity and going out there and making a difference that will eventually, hopefully, trickle down back home. It would be meaningless to be highly trained, highly qualified, and then sit in an office waiting for retirement. I think that would be a bad choice for that professional.
Yeah.
So those who take up those opportunities out there and are able to make a difference in the life of human beings, I say kudos, and I say go on doing what you do until we in this country are able to set aside resources that will be sufficient to attract you back to make a difference here.
Okay. Eunice, let me just bring in the issue of COVID-19 here, because I think I saw quite a number of innovations. I think I saw quite a number of students who are coming up with robots. There were those who are making this, what should I call, the ones that the system that they were using to assist patients to breathe. I'm losing the name.
Ventilators.
But, yes, the ventilators and the prototype for ventilators. But are you satisfied by the contribution of learning institutions at that very critical juncture?
I think learning institutions did step up as much as they could. But this still goes back to the issue of funding. For you to actually be able to bring up your ideas, your innovations, and actually refine them, all that is a process that requires funding. And we do know funding into higher education is still quite, it's a lot, yes, it looks a lot, but it still doesn't quite meet the needs and the demand. And we know education, a good quality education, we've talked about quality education, is expensive and is beyond reach, so to speak. Hence the reason funding is required. So the universities did step up, whether it's innovation around how to deliver care, whether it's innovations around, sanitizers and things like that. People did step up. it could have been a lot better with a lot more investment, because, you know, for you to actually come up with the idea, refine it, and be able to put it out in the market, that's a process that requires huge investment. Going back to the issue of the middle level colleges came also into place. We saw a lot of food stamps, hand wash points that really were not necessarily very IT savvy or anything like that. They were mechanical in nature, but they actually solved the solution.
Yeah.
So again, going back to the point of local innovations that actually meet the needs of the local people, because if I'm somewhere where there's no electricity, that hand washing equipment did not require electricity, so it solved a problem there. So I think it's a way of thinking about what is it that we are investing in and how much money are we putting into it, and whether that innovation and that new idea actually meets the needs of the population that we are trying to serve.
Okay. Alex, in 3 days' time, the National Treasury CS will be presenting the 2021-2022 national budget. Part of it is, a lot of it is anchored on the finance bill and policies that are naturally always passed in Parliament, and which actually most of the time dictate the direction our country is taking. But the question then would be, are learning institutions playing a critical role in the policies that we have today? Are they informing policy changes and policy directions?
So, Victor, before I come to, I think, let me frame it this way, in a related way.
Yeah.
I think one of the problems that we face in the country is, yes, there is investment in higher education, which is great, in education generally.
Yeah.
A lot of it goes to recurrent expenses, paying school teachers and capitation. That's not incremental developmental investment in education. So we need to settle that conversation. So when the president will present, when the President Kenyatta's government will present the budget, let's not get too excited about the numbers in hundreds of billions that are going to education. That's besides the point. I think what we need to think about is, what is the new investment in development in education, not just sustaining recurrent commitments. But the point that I want to make, which basically is Achilles' heel, the stay-maze progress in innovation and research in the country, is the disconnect between three critical elements that are important to drive innovation, to find solutions that are appropriate to solve our problems.
Okay.
We have universities sitting somewhere, the ivory tower, as we used to call it, or higher education. We have industry on the other side waiting for universities to provide them with students to go to work. Then we have communities who are waiting for problems to be solved. It is very rare that you find universities who understand the genius of forging a working relationship among these three communities. Universities cannot exist in silos. We cannot sit here in our ivory towers, educate students, and expect that they will be ready to work day one, when we're not even talking to industry, when leaders of industry never step into our classrooms as adjunct professors to teach. It just doesn't make sense. It doesn't make sense when our students finish university without interacting with communities, and then they go out there to work. So for instance, what Eunice just talked about, the straddle pump for dispensing hand wash or sanitizers, for instance, it is a genius of a solution. But it requires refinement by working with local communities. If I'm disabled and I don't have, how do I operate the pump? And I still have access to education, and I still go to a market, a public place. So we need to think about the role of this tripartite. There's a tripartite interaction: community, industry, and higher education. But we also have to hope that we elect literate politicians who can push beyond just funding recurrent commitments. We need a substantive incremental trajectory in our budget appropriations to support new innovation and new developments in education expansion. So I'm really not excited about the numbers that we're going to read. We know some of those numbers. It is basically meeting recurrent commitments.
And I take note of the fact that you use the word literate.
Well, yeah, you know, literacy is beyond just going to school. You know.
Okay. Dr. Atwoli, what I'm getting from Alex, what Alex is saying is an issue of partnerships between like-minded sort of partners, but also the issue of having some sort of a common goal.
Mm-hmm. Yeah. So I think a good education system, and especially at the higher education level, would base the classroom interaction with students on what's happening outside the classroom. So community interaction and partnership with the communities around these institutions of higher learning is indispensable, both as a source of the problems that we teach our students to solve, but also as the laboratory, if you like, in which we test these ideas and see whether they work or not. You can have the most brilliant idea in the entire world and create the best gadget in a laboratory. But when you take it out into the real world, it is useless because it doesn't respond to a real problem in the community. So a university must partner with the community. So and this is why when we design medical curricula, for instance, at AKU and in the modern paradigm of medical education, we have to locate it within a community. We have to locate it within an area where our students are able to understand community needs and link those needs to what they are being taught in the classroom and in our wards. So the community element is completely indispensable. And many people think about communities as people living in the villages, and the quintessential community is what we call the Wanjiko, living somewhere rural. But communities are urban. There are urban communities. There are peri-urban communities, and then there are rural communities. And as we design programs, as we design projects and the curricula, we have to take into consideration that even people in urban communities have needs that bring them together as urban communities and peri-urban communities that need to be addressed. So that is absolutely essential. The second link that Alex alludes to, which is to industry, and industry here is industry, broadly speaking, including, even Juakali, for instance, if you're teaching engineering and you're not having any contact with the people who are making the gadgets that make everyday life easy in our Juakali industries, then really you're not having an impact. And an education without an impact is really, glorified folklore, if you like.
Okay.
So we have to ensure that it is contextual, it is relevant, and it addresses a real problem in our communities, whether presently or even in the future.
Okay. What an insightful conversation we are having in studio with Dr. Eunice Ndirango, Dr. Alex Awiti, and Dr. Lukoye Atwoli about the contribution of higher learning in, of course, the achievement or the progress towards achievement of sustainable development goals. But what do you think? Do you think learning institutions are playing the critical role they should be playing in informing public policy in the direction the economy is taking and the progress towards the sustainable development goals? Give us your feedback. Tweet us at NTV Kenya, at Victor Kiprop _ Use the hashtag #NewNormal on Twitter. Follow the conversation on Facebook, Instagram, and YouTube as well. When we come back, we can sample part of the feedback you're sending us, and we pick up from where we left. Don't go too far. What a beautiful sight there of the falls in Tharaka-Nithi County. Indeed, if you have not been there, you should. Tembea, Kenya. Thank you very much for staying with NTV. We are talking about higher learning institutions and their contribution towards the achievement of sustainable development goals. I'm in studio with Dr. Eunice Ndurangu, Dr. Alex Awiti, and Dr. Lukoye Atwoli from the Aga Khan University to help us break this and dissect this discussion. Dr. Atwoli, let me just start with you at this point. During this COVID-19 period, for the first time, many countries were looking at their health workforce as sort of the defense force of the country, because they were the team defending the country from the COVID-19 pandemic. And for so many people, it was a rude awakening of just how much importance we should attach to training a quality healthcare workforce.
Yeah, absolutely. I think when we are facing a global pandemic such as the COVID-19, it is absolutely true that the health workforce are the frontline workers. They are the ones who are, in fact, people would say the first line of defense, but we look at them as the last line of defense. The ones who have to deal with the most severe illnesses, the ones who are put at risk when they are facing patients who come to hospital with severe disease. And this underscores the importance of preparing these health workers. I would tell you that the goal of training any health worker, and I can say this without fear of contradiction, is to prepare them to deal with situations such as what COVID-19 presented us with. What they do on a day-to-day basis is really preparation for a catastrophe. Mm-hmm. And when the catastrophe happens, they ought to be prepared, they ought to be ready, they have to think on their feet as they start solving the problems that are coming their way. And COVID-19 has demonstrated the importance of training health professionals in the local context, but with an eye on the global situation, so that we are not only training health workers who are relevant in our village or in Kenya, but we are training health workers who are prepared that if anything happens in Nepal, for instance, they are able to make a contribution in solving that problem. So COVID-19 has demonstrated the interconnectivity across our health systems, that we cannot ignore a small outbreak in Wuhan in China, thinking that it will only be contained in China. But within a few weeks, it is here in Nairobi, in our homes and in our villages. So health workers being trained today must be trained to be locally relevant, but also globally responsive, understanding what is happening in the globe and seeing how that affects our situation in the country. And so this is a philosophy, I would tell you, that we are pursuing as we train health professionals within AKU. The programs that we provide at AKU currently, our residency programs at the medical college, prepare graduates who can work anywhere in the world. These are guys who get credentialed in the UK and in the US, not because we're preparing them to go work there, but preparing them in a manner that ensures that if a problem such as that bedeviling the UK today showed up on our shores, they would be ready to deal with it. And this is, I think, a core characteristic of a sustainable and a responsive health professional education system. And obviously, another problem with our health professionals education in the past was that people would be trained in silos. So if you're going to become a nurse, you're trained only on nursing. If you're going to become a medical doctor, you're trained only on how to become a good medical doctor. But we forget, you cannot become a good health professional if you're not trained in an interprofessional environment right from the get-go, where you can see the role and contribution of other health workers in the health team. So it is absolutely important, and COVID-19 has demonstrated the importance of this, that none of the health professionals working alone can deal with this pandemic in any meaningful way.
Dr. Maybe for anyone who's not used to the initials, we should clarify that AKU is indeed Aga Khan University. And maybe can they find that environment that you're talking about at Aga Khan?
Absolutely, absolutely. So all the programs that we design, we require that there is an interprofessional component so that people can appreciate the roles of other professionals within the health ecosystem. We also insist that whatever they are learning is derived from the local environment, but it speaks to a global need. So as people go to class, as people go to the wards, as people interact with patients, they know that they're doing this in order to learn how to handle this thing if it gets out of hand. They learn how to deal with problems that we think are problems of elsewhere. In the past, we thought chronic diseases like heart disease, cancer, and so on were diseases of the West or diseases of opulence. We are learning now that the diseases that are here and they're with our people, and we have to be prepared to deal with them.
Okay.
Our previous focus on infectious diseases or diseases of so-called poverty was misguided, because at the end of the day, our population has different levels of people, different exposures, and people have to be prepared to handle everything, including things that we think happen only in other countries.
Right.
And so a responsive health professional education has to take that context into consideration as we train our health professionals.
Okay, let me just take us back, because I mean, if we are talking about healthcare workers being the defense workers, you are right in the trenches and right at the enemy lines. Let me just get your perspective with regards to what we've been talking about with Dr. Atwoli.
Indeed. If you look at, and you know, all of us last year were celebrating the year of the nurse and the year of the midwife. And interestingly enough, there was very little celebration because then COVID-19 came on. But to me, the fact that the pandemic came on demonstrated the critical role that nurses and midwives play in the healthcare system. And if you look at the recently concluded World Health Assembly, a lot of conversations were around the fact that if we were to strengthen our healthcare systems, we can't really do that without investment in nursing and midwifery, because then that becomes the sort of the backbone that, you know, leads when it comes to a response to healthcare, whether it's in the essence of promotion or in the essence of treatment, care and support. But Lukoi raises an important point about interprofessional learning and interprofessional education, and not in the sense of having 2 or 3 different healthcare cadres sitting in the same classroom. It's about creating that perception and that ability to appreciate what every person who is a part of the healthcare system, what role do they play? And so, for instance, now as we plan for the Bachelor of Science in Nursing straight from high school, and as the medical college plans for their undergraduate medical program, we are emphasizing on that as an ethos of what drives the program, because in the end, if a nurse sitting in the same classroom with a doctor, but also going to the field at the same time and realizing what is it that each person brings to the table, then leads to a process where the healthcare system is seen as an ecosystem, not a situation where there is a doctor, there is a nurse, and each goes in their different direction. So a concerted effort that then brings everybody on board and then ensures that we have a synergy when it comes to dealing with healthcare issues. That is what is going to help us then go to SDG number 3, which ensures that we are talking about quality and good access to everyone across the lifeline.
And I'd like to go to Alex on that issue of the challenges, of course, the gaps between learning institutions and SDGs. But just before I let you go, outside AKU, because, I mean, Dr. Atwoli has clearly highlighted the issues out there. Sometimes we find ourselves in situations where we even perhaps need to bring in more workers from outside the country. There are people who are trained inside the country. What are the gaps, the barriers to training of healthcare professionals in the country that put us in this kind of a precarious situation?
I think this goes back to the idea that there has to always be a direct link between what policies are there, what is in the environment, versus what it is we are training. So, for instance, if you're going to train healthcare workers to come and work into the public health system or the private health system, what is there? What preparation is there in that system to actually take on those healthcare workers? So, for instance, we've had situations where we find, you know, we need a certain number of nurses, but we do have nurses who are trained but are not employed. So what is the connection then between higher education and the policies on employment or opportunities of employment? So again, it goes back to what Alex was saying about education not being very separate from what else is happening around. Turn this around. If, for instance, we were to say we have too many healthcare workers, they are not employed, we've employed what we have, do we have a formal system of then saying, okay, can we then intentionally have a certain group of nurses, for instance, go to a certain country to work, and then it also becomes an income for the country that helps us improve the infrastructure of health that exists. So we do know other countries do that. Philippines is a good example. So there are many opportunities there, but for me it's that connection between who is training, who is employing, and what are the policies that exist in the national and county levels, because then all that must come together.
Okay. Alex, I know you might want to respond to some of the issues that Dr. Tuwale and Eunice have raised, but even as you do that, earlier on you mentioned the issue of funding. Other than funding, or including funding then, what is this gap that is separating learning institutions, higher learning institutions, from the role that they should be ideally playing, or at least playing at the optimum level in terms of helping us achieve or progress towards achieving sustainable development goals?
So I'll speak very bluntly as an African. I think one of the things that disconcerts people like myself who have been in higher education and also international research is the fact that our governments discount counsel and advice that comes from people who look like me and sound like me, and especially people who work in universities such as the ones we work in. You know, I was educated here most of my life, Moi University and Nairobi University. I don't see my colleagues, my senior professors at the University of Nairobi, sitting at the high tables of policy advice for our government. That's a critical problem. And that's an indictment on our political class and the policy apparatus that determine the direction of this country. We listen to people from the World Bank because of how they sound, the color of their skin, and the universities they went to. Some of us sitting here went to some of the fancy universities in the West, but I still can't sit in the ministry as an advisor. They will still go to McKinsey and all these other guys, for instance. So that's a serious problem. And that is not because there is lack of talent in this part of the world. Lukoya Tuli here sits on international boards. I sit on an international board. Eunice sits on international boards. But we are not invited to these boards in our own country. You know, my intellect and my experience from this part of the world is being utilized in other parts of the world to solve global problems. The other point that I also want to mention is that, for instance, we have tremendous experience during this period of the pandemic. COVID-19 is asymptomatic and mild in about 80 to 90% of those who are infected. What that shows us is that the centralized, medicalized approach to health is extremely flawed. We need to strengthen community health systems to deal with disease, with pandemics. And that discussion is not even bubbling to the surface of our discourse in managing our healthcare system. That's a problem. And our health systems, including Aga Khan University, is demonstrating that very clearly. Very few people who get COVID infections require intensive care. It's a very, very small proportion. The burden of care is in respiratory therapy, which can be administered outside formal health systems. And that means that we need an army of community health workers. We need an army of doctors and nurses who can work in rural areas. Most of the ones that we train troop into the cities looking for fancy clinics that charged a ton of money for patients who were much more affluent in urban areas. So I think we need to reimagine our healthcare system. We need to fund healthcare system in a different way. We are somewhere along the way with devolution, which means that we are moving healthcare closer to the population. But we're now proliferating all these level X, Y, Z, but we're forgetting the community health dispensary infrastructure, which is where the majority of Kenyans really need help, and we seek help, we'll find help. We need to figure out a model that privileges disease prevention and health promotion. It is not a medicalized approach. It means that to the extent necessary, avoid going to hospital. Create a process of health promotion through literacy that mothers and caregivers at the household and at the community level can prevent diseases through health promotion approaches. So I think what is missing now is bubbling new policy-focused conversations that reorient our healthcare system away from over-dependence on a medicalized approach to health to one that is more community-centered. And that's a policy gap. And that means that they need to start listening to people like Lukoye, people like Eunice, and many others around the country who are basically saying it is time to reevaluate and reimagine our healthcare system. Okay. And that's a critical goal of higher education. And it is deeply entrained in the process of attaining the Sustainable Development Goals.
Okay. Dr. Atwoli, I'm sure you're waiting to respond to some of the things that Eunice and indeed Alex have been talking about. But even as you do that, part of not really the excuse, of part of the problem why most universities, public ones, actually struggle is because they have to wait for government to release that funding. They have to wait for the budget and look how much has been allocated to research in our institutions. So maybe for private institutions, maybe for Aga Khan, are you investing adequately in quality education and churning out the quality professionals that we need, even as you respond to the other issues?
Yeah, so I'll respond to this question first, and I'll go back to what Alex was saying. Okay. Importantly, an institution like Aga Khan, which doesn't depend on government largesse, has to look to other sources of funding. And we are fortunate that there are many private individuals who have, denied themselves of certain luxuries of life and contributed to an institution like Aga Khan University, so that we are able to do the things that we do. And we are hoping that this culture grows in this country, where people see that their shilling can go that much further when they contribute to a cause bigger than themselves, such as education and health and so on and so forth. So that is important. And with the resources that we are able to get from the various sources, including from His Highness the Aga Khan, we mobilize these resources, we channel these resources in areas that we think would have the highest impact. And research is one of those areas. We have intramural grants that we give to our faculty and residents and students to carry out research in areas that we think are priority areas in the community. Obviously, it is never enough, and we look to other sources of funding for research to support, including our National Research Fund, which funds some of the work that we do. And importantly, there are international funding agencies that find value in the work that we do, and they're willing to commit dollars and pounds to support it so that we are able to contribute to the health ecosystem in this country. So we are prioritizing research as a way of strengthening health professional education, and also as a way of ensuring that the quality of care that we deliver to our patients is of the highest attainable standard as required by our Constitution and international human rights movements. Now, having said that, then, I will go back to what Alex was talking about, the approach to the health systems.
Yeah.
And I would say that COVID-19 has not taught us anything new. COVID-19 has in fact just emphasized how health systems are supposed to be designed. If you look at the optimal design of health systems, it's a pyramid. And the biggest component of health interventions is in the community and in homes and in families. It's what you eat, is whether you have exercise, is who you speak with, who you hang out with, whether you take alcohol or not, whether you smoke. It's out there in the community, and it is health promotion and prevention of disease that are the pillars of a functioning health system. And then the treatment components, when you start talking about hospitals, the curative component is further up on the pyramid, where fewer people require that, but it is absolutely essential because of the life-saving nature when people need that kind of care. So what COVID-19 has done is to expose weak health systems that were not properly designed to address things right from the community level up to the curative level. And our systems have been tested. And in fact, the US has been tested. Everybody has been tested and found to be wanting in the fact that you design health systems that are more curative than looking at the community component, health promotion and prevention. Okay. And as I conclude, I would add that medicalized is not a bad word. If you think about medical in the context that it looks at health promotion, it looks at prevention of disease, it looks at treatment of those who get sick, and looks at rehabilitation of those who have chronic needs after they have been unwell. So a medicalized system, in fact, is a system that ought to address the health of an individual right from the community, right from birth up to old age and up to the time when they require more specialized services in our hospitals.
Okay.
And that is what we need to put in place.
Yeah.
I think what I meant is hospital-based, hospital-centric.
Okay.
Yeah.
All right. Thank you. And of course, the lady and gentlemen, there is a lot to say. There is a lot to learn. Time may not be enough, but, and unfortunately, we have to wrap this conversation. Allow me to take your closing remarks, and I'll start with you, Dr. Ndurangu.
Thank you so much. I have 2 points to make. One is, I think we need a system that learns from experience. If we look at the approach to healthcare during the time of HIV pandemic was around, it was very, again, home-based. We had a lot of services brought back down to the home in terms of following up on treatment, on care and support. We now have COVID and we are seeing home-based care working very well. So my key question would be, how then do we transfer that to all these other diseases? We are talking about non-communicable diseases going quite high, and so how do we then transfer lessons we are learning along the way to ensure that at least we are improving the healthcare system? My second comment or final comment would be, we have to think about education as education that just doesn't train for today but trains for tomorrow and the day after. If we train the same way we trained for issues that are happening yesterday and expect that the graduates will be able to function tomorrow, then we will have failed.
Okay. Alex, your parting shot?
Thank you very much, Victor. I think we're quickly running out of headroom on the model of economic development that is kind of based on services and consumption. The next epoch of our economic evolution as a country, as we move into kind of the mainstream middle income economy, is going to be driven by research, innovation, and development. We need to move on this continuum, and that means that the government has to ramp up support in terms of research that goes into public education systems, and also figure out how to support the emerging private education components that are very critical to the total balance and overall capability of our education infrastructure. Now, what that means is that, NACOSTI is one potential capability, but the government needs to create, as Lukoye suggested, many more funding opportunities, funding buckets to support higher education. It is absolutely shameful that in this day and age, so many years after independence, we still depend on the largesse and the generosity of Western countries to support research in our country. Now, what that means is that a lot of us are relegated to just native informants. We are co-PIs rather than driving the critical elements that create the next frontiers of innovation and capability to enhance a solution approach to our problems. So I would really call upon the government, as we think about even this budget, there's still opportunity for us to really reimagine funding for research, innovation, and development, but also to really install a working relationship and a partnership between universities, community, and industry.
All right. Thank you, Alex. Dr. Atwoli, please close the conversation for us in your closing remarks.
Thank you. Thank you very much. What I would say about higher education is that we have to start going back and restore institutions of higher learning as thought leaders in our societies. We have to end this fetishization of universities in the villages, which results in villagization of higher education and removes its relevance. We have to fund higher education so that we can start generating the information that we need, rather than having 1 million universities that are really glorified high schools, if you ask me. So without the research function in higher education, then we are really just glorified high schools, and our government has to start thinking around that. And of course, I never ever finish anything I say without asking that we also focus on mental health. COVID has tested our mental health. It's through our education systems, through our health systems, we have to start focusing also on how to ensure that we take care of ourselves mentally if we are to achieve any of the sustainable development goals that we have set for ourselves.
All right.
Thank you.
Thank you very much, Dr. Lukoye Atwoli there, and of course my other panelists this morning, Dr. Alex Awiti. Of course, he is the Vice Provost for East Africa at the Aga Khan University, Dr. Eunice Ndurangu, the Dean of School of Nursing and Midwifery at East Africa, for East Africa at the Aga Khan University, as well as Dr. Lukoye Atwoli, the Dean for Medical College, East Africa at the Aga Khan University. We have been talking about higher learning institutions and sustainable development goals. From me and the entire team, it's bye for now. We'll see you again tomorrow.